Welcome to today's episode, a special companion piece to the insightful course titled 3 CE Hours Addressing Stigma and Shame in Addiction Treatment, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist seeking to deepen your understanding of the stigma surrounding addiction and the pervasive feelings of shame that accompany it, you're in the right place. In the next few minutes, we'll unpack the key concepts from the course, explore common misconceptions, and provide practical insights that you can apply in your practice. So, let's dive in. First, let's define what we mean by stigma and shame in the context of addiction. Stigma refers to the negative attitudes and beliefs that society holds about individuals struggling with addiction. These judgments can lead to discrimination and social exclusion, making recovery even harder. Shame, on the other hand, is an internalized feeling that arises when individuals perceive themselves as flawed or unworthy. It's that nagging voice in the back of the mind that says, "You're not good enough." Understanding these definitions is crucial because they set the stage for how we approach treatment. In the course, we learned that stigma and shame can act as significant barriers to seeking help and maintaining recovery. But don't worry, we're not just here to highlight the problems. We're here to explore solutions and strategies that can empower both clients and clinicians. Now, let's delve into our first main point, the impact of stigma on addiction treatment. Research indicates that the stigma surrounding addiction can significantly deter individuals from seeking the help they desperately need. Picture this. Someone struggling with addiction might think to themselves, "What will my friends and family think if they find out? Or I'll just be judged. It's better to suffer in silence." This fear of judgment can prevent them from accessing critical treatment services, leading to prolonged suffering and potential relapse. As professionals, we have a vital role in dismantling this stigma. One effective strategy is to foster an environment of empathy and understanding. This means actively listening to our clients' experiences without judgment, validating their feelings, and normalizing their struggles. When clients feel seen and understood, they're more likely to open up and engage in the therapeutic process. Let's take a moment to reflect on a story that illustrates this point. Imagine a client named Sarah. Sarah has been battling addiction for years, but has always felt like an outsider due to societal perceptions. When she finally mustered the courage to seek help, she was met with a compassionate therapist who embraced her story with empathy. The therapist didn't just listen. They shared information about addiction as a disease, normalizing what Sarah had experienced. This simple act of kindness helped Sarah begin her journey toward healing. Now let's transition to our second point, addressing shame in the therapeutic setting. Shame can be debilitating, often leading to a cycle of self-destructive behavior. In the course, we discuss techniques to help clients work through their shame. One of the most effective methods is to help them reframe their narrative. Instead of viewing themselves solely as an addict, encourage them to see their journey as one of resilience and strength. Consider introducing exercises that promote self-compassion. For instance, you might guide clients to write a letter to themselves from the perspective of a supportive friend. This can help them recognize their inherent worth and the struggles they've overcome. When clients learn to practice self-compassion, they begin to break the cycle of shame and can approach their recovery with a more positive mindset. Now you might be wondering, what about the misconceptions that surround addiction, stigma, and shame? This brings us to our third main point. There are several common misconceptions that can hinder our work as mental health professionals. One prevalent myth is that addiction is simply a lack of willpower. This notion not only oversimplifies the complex nature of addiction, but also perpetuates stigma. It's essential to educate both ourselves and our clients about the realities of addiction. For example, addiction is often rooted in a combination of genetic, environmental, and psychological factors. By understanding this complexity, we can better support our clients and help them navigate their recovery journeys. Another misconception is the belief that individuals in recovery should simply get over it. Recovery is not a linear journey. It's filled with ups and downs. We need to remind ourselves and our clients that setbacks are not failures, but rather opportunities for growth. In the course, we also explored the importance of language. The words we use can either reinforce stigma or help break it down. For instance, using person-first language, such as a person with substance use disorder instead of an addict, can foster dignity and respect. Small changes in our language can have a profound impact on how clients view themselves and their experiences. As we approach the conclusion of our discussion, let's take a moment to reflect on some thought-provoking insights. One key takeaway from the course is the power of vulnerability. As therapists, we can model vulnerability by sharing our own experiences, when appropriate, or acknowledging our own biases and challenges. This can help clients feel less isolated and more connected. Additionally, consider the importance of community support. Encourage your clients to build a network of understanding individuals, whether through support groups, friends, or family. When individuals have a support system that embraces them without judgment, they are more likely to thrive in their recovery. Now I'd like to wrap up by challenging you to think about your own practices. How can you incorporate the principles of empathy, self-compassion, and stigma reduction into your work? What steps can you take to create a more inclusive and supportive environment for your clients? As you ponder these questions, I encourage you to explore more resources on this topic. Therapy Trainings offers a wealth of information, including courses specifically tailored to address stigma and shame in addiction treatment. Visit therapytrainings.com for more courses and tools that can enhance your practice and empower your clients. Thank you for joining me today. Remember, addressing stigma and shame is not just about the individual. It's about fostering a culture of understanding and compassion. Together, we can make a difference in the lives of those struggling with addiction. Until next time, take care and keep fostering the change we want to see in the world.